So today's topic is food sensitivity. Page 508. Those who have the new textbook, please check the page number. Chapter 23, 508. If it's a new textbook, page number may slightly vary. Please mention the new page number in the chat box. This is the repeat class. Before we go to the disease conditions. So food sensitivity. So food sensitivity, it happens when your body's immune system, which is supposed to fight infections, foreign bodies, or has to fight any invaders, any form of infections, it will start seeing food as the invader as well. Okay. Your body's immune system will start reacting in the same way how it will react when you get an infection just based on certain food substances. Okay, so that is food sensitivity. Hypersensitivity reaction is also another name for it. So like allergies and all, okay, food allergies and all will come under hypersensitivity reactions. So food sensitivities versus food allergies. Okay, what is the difference between that? Sensitivity is intolerance as well. Okay, food sensitivity can start at any age. Okay, majority of us do suffer from some form of food sensitivities, but we are not aware of it. Okay, we think that it's just gas, it's just bloating. Okay, maybe we had overeaten anything or something like that. People will consider it as some other reason. Okay, they will not see it as food sensitivity. Okay, so like whenever you have some specific kind of food, you feel bloated. Okay, nauseated. There is some acidity like reactions. So those come under food sensitivity. Majority of us, everyone is either sensitive or intolerant to some or the other substance. Okay, and whenever you ingest that substance, your body reacts. Okay, and the reaction is not immediate. That is the main difference between food sensitivity and food allergy. Okay, in food allergies, the reactions are immediate. Immediately, your body will start shutting down or showing signs and symptoms very similar to allergy. Okay, but in food sensitivity, today, if you have had some food, by evening you may see nausea, diarrhea, constipation, or after 2 days or something like that. So it is difficult to track. Okay, food sensitivities are difficult to track. You feel like you are bloated, but you don't know why. Okay, you had some good food, you didn't had something out, but maybe 2 days back you may have something specific triggers. Okay, and on the third day you are seeing the symptoms, so you're not able to track properly what is the cause of it. Okay, so bloating, joint pain, IBS, tiredness, eczema, low mood, headache, weight gain. Okay, these all are some signs and symptoms associated with food sensitivities. It's not deadly. Okay, it is not an emergency kind of situation. So the most common sensitivities are gluten sensitivity, milk, dairy, corn, eggs, sugar. Okay, these are the most common types of food which usually cause sensitivity. Cow's milk as well. In children, some children, they cannot tolerate cow's milk. Okay, goat milk or buffalo milk is fine for them, but cow's milk is not. Okay, that is also a type of food sensitivity. And you can have multiple food sensitivities as well. Okay, it's not that if you are having a gluten sensitivity, you may have you may be lactose intolerant. Okay, you may be allergic to gluten as well. More than one food sensitivities can exhibit. Okay, and you have to be very careful if people say that I have a sensitive stomach. Okay, some people say I have a sensitive stomach. It's usually that they are suffering from more than two forms of food sensitivities. Okay, next coming to food allergies, it's developed from infancy. Okay, mostly children will have for some form of food allergy or any other form of allergy. Okay, sometimes children may grow out of these allergies as well. 2% of adults, 6 to 8% of children have some or the other form of food allergies. And whenever you ingest these triggering food, immediately signs and symptoms will show up. Okay, within less than 2 hours, signs and symptoms of food allergy will show up. Skin issues, digestion issues, airways closing, okay, not able to breathe, airways closing up because of swelling. Your airway trachea will become swollen. So very less amount for the air to enter the lungs. It can lead to reduction in oxygen. Okay, so that's how it can be deadly. Okay, it can lead to life-threatening reactions as well. So most common types of allergies, peanut allergy or any form of nuts, tree nuts, peanuts, eggs, milk, fish, shellfish, or any form of seafood. These are the most common causes of food allergies. Okay, and you will not have multiple allergies, either one or two. Okay, one person usually has one or two forms of food allergies, not much more than that. And there are chances that children may also grow out of the allergy. In childhood, they could not tolerate cow's milk, but by adolescent age, okay, they are able to tolerate cow's milk well. Like that change or shift can take place. Okay. Is it clear to all the difference between it? Then adverse reactions to food, you can have a toxic reaction or non-toxic reaction. Food toxicity is different topic, okay? So, it is very similar to food poisoning as well, okay? Uh, for adverse reaction to food, either it could be toxic or non-toxic. With food, maybe you may have ingested some very toxic substances like mercury, lead, or some poison by mistake, or some chemicals, okay, overdose of any chemicals or something like that have mixed up. Okay, some drugs got mixed up. Okay, those will lead to toxic adverse reactions to food. Those, that's a different topic. Okay, under non-toxic reaction, you have the allergies, intolerances, sensitivities, and all. Okay, so in the non-toxic adverse reaction to food, you have immune mediated and non-immune mediated. One in which your immunity is acting up, your immunity is interfering, okay, in one type of adverse reaction. The non-immune mediated, immunity has nothing to do here, okay. It's the physiology. It's your basic physiology that is causing issues, okay. For example, enzymatic non-immunitic immune mediated adverse reaction in which you may have additional or you may have no absence of certain enzymes. Okay. And because of which you may, for example, lactose intolerance. Lactase enzyme is not present. Lactase is the enzyme which your body is supposed to prepare. Okay, when the body stops preparing it, that's when you become lactose intolerant. Okay, so that is one example of enzymatic adverse reaction. Then pharmacological, certain people who are on aspirin, okay, blood thinners, uh, ethanol, capsaicin, these are different types of drugs which can interfere with usually your hunger, appetite. Okay, so because of which it may affect the, it may lead to adverse reactions in food as well. Coming to non-toxic, which is immune mediated. So two types of responses you may have: adaptive immune response and innate immune response. Okay, adaptive is where the T cells, your antibodies that your body has made already, it will understand the food as an invader. Food does not require any antibodies until and unless uh, it is not like it has some bacteria or it is not hygienic. Okay, if the food is hygienic, it should not act as an invader. Your immunity should not treat it as an invader. Okay, so when the immunity treats the food as an invader, a specific type of immunity like T cells and all, immunoglobulin E T cells, okay, they are adaptive immune responses. Usually, when people suffer from celiac disease or food protein induced enterocolitis, in this kind of situation, T cells will consider gluten or it will consider any causative agent of a specific food as an external agent, invading agent. It will try to make antibodies out of it. Okay, and also use up the antibodies which is already it has prepared. Okay, it will use it up for the toxicity reactions of food. So innate immune response, it's like your innate immune cells, which you already have, okay, like your physiological barrier, chemical barriers. Something, if it is wrong or something like anything wrong that you have eaten, okay, it will not get digested properly because the immune cells are interfering with taking out whatever it considers as an invader. Okay? So that's about the adverse reactions to food. Coming to food which is involved in sensitivity. So animal sources, cow's milk. Cow's milk has casein, the protein, beta lactoglobin. These are major allergens because of which cow's milk can cause pain in small children. Okay. It can also lead to blood in the feces, in the stool. Okay. If the person is allergic or sensitive to casein or beta lactoglobin, only in those cases. And children who are milk tolerant, they will not have much reaction, okay, to cow's milk. When you're buying food from outside, you have to check the food, check with the menu at least that what ingredients they are using. Only if the client or if you are dealing with multiple allergies, food allergies. Egg is also a common consideration when it comes to allergic reactions in body. Anyone who is milk sensitive or milk intolerant should make sure that cheese, butter, casein, curds, lactalbumin, lactoglobin, lactose whey, they also have the same compounds which they found in milk. So these also has to be avoided. Some people are allergic to beef as well, red meat. Okay, seafood we all know it is also another common cause of allergic reactions. So that's about the animal sources. Then coming to plant sources, peanuts, okay, it's the most common allergy. Wheat, gluten. So when if you are allergic to wheat, wheat is also kind of a staple food in India, northern and western in India. Okay, wheat is a staple food. So if somebody is wheat allergic, other products like bread, rava, semolina, they are also the byproducts of wheat. Those also have to be avoided. Okay, just by avoiding the wheat atta, okay, it's not solving the problem. Other hidden areas are also there in food. Those has to be avoided. Mushrooms, we don't know if it is a plant source or an animal source. It comes under both categories. It's a fungi. Mushroom is a fungi, so it comes under both categories. Soya also, some people are allergic to soya. Peanuts also very common. Refined oil is okay. It's not that issue. It will not cause much issue. Peas, gingery seeds. Okay, these also have a history of producing allergic reaction in some people. Then beverages, alcoholic beverages. You can be allergic to that if you have issues with beer. Okay, whey. Uh, if you have issues with gluten, then you will also have issues with uh, like wheat or the byproducts of beer and all. Okay, if you have allergy to rye, out of which some beverages are made. Okay, fermented beverages are made. Some forms of rice wine and all. Okay, barley Okay, these all are used for preparing some fermented drinks. Okay, every region has their own way of fermenting certain grains, cereals, making it into some fermented beverages. So if you are allergic to that, you will be allergic to those drinks as well. Those beverages you have to avoid. Wheat is used in whiskey. Okay. Yeast, barley and yeast are used in beer. Okay. Barley has gluten as well. So beer should also be avoided. Some champagnes and beers will use yeast as well. If you're allergic to yeast, avoid those champagnes. Very rarely people are allergic to other beverages like coffee, tea. Okay, if you're allergic to certain fruits, their fruit juice or shakes will also be same. It will cause the same allergic situation. So that's about beverages. Then we have fermented food. Fermentation takes place because of a bacterial colony. Okay, and if you have allergy to certain bacterial colonies present within your body or even from regularly that you are used to from food, okay, fermented food, those specific fermented food will not be for you. Usually the fermented foods are raisins, beer, wine, cheese, pickle, vinegar. Okay. Then food contaminants, preservatives, insecticides used. Okay, they also, if it is not fruits and vegetables bought from the market, farmers market, if it is not cleaned properly, okay, that can also lead to food contaminant based allergy. Preservatives and all may still be there in the harvest and it can cause allergy. Some chemicals are also used to keep the harvest as fresh as possible for longer run. That can also cause issues. So that's about the food involved in sensitivity. Is it clear to all? Now coming to symptoms. Okay. So different types of symptoms you will see. Not everyone will have the same kind of allergic symptoms. Okay. If you have an allergic reaction and if it is showing up on your skin, usually it could have dermatitis kind of a situation. You may have swelling, edema, fever, certain blisters, urticaria. Urticaria is what you see here. Okay. We call it as hives as well. Okay. These small bumps, which are very itchy. Okay. You feel like itching them. They are very hot, warm, red in color. Okay. That's urticaria. Rashes, erythema. Okay. That area will become or you will be flushed. Eczema, pruritus of the lips. So these are the most common skin manifestations. And usually, the most of the skin manifestation, whatever you have, is you feel the excessive need to itch. Okay, itch or just scratch that area. You will have that desire to do that. So, majority of the skin manifestations has that reaction when you're allergic to something. Then your GI tract, okay, your stomach, intestines, there could be blood in the feces that you pass out. Okay, cheilitis, stomatitis. Stomatitis is like your ankles of the Angular stomatitis, the area corners of your mouth, okay, that become itchy, scaly, flaky, okay. And if it is a small child, then the child will cry a lot, okay, without any reason specifically, but it is understood that the child may be in pain. That is colic infant. Okay, the child will cry in a very shrill voice for long hours. That is colic infant. Malabsorption, abdominal pain, cramping, constipation, distension of the stomach, like the stomach feels like it is completely full, but it could be like bloating as well. Diarrhea, dyspepsia, indigestion, flatulence, that is keep on they will keep on farting throughout the day, nausea and vomiting. So that's the most common gastrointestinal tract manifestation during a allergic reaction or food sensitivity reaction. Coming to respiratory, am I audible to all? Is my voice clear? Am I audible? Coming to respiratory symptoms, continuous sneezing, runny nose, okay, allergic rhinitis. You may have itchiness inside your throat or inside your ear, asthma, bronchitis, not able to breathe properly, shortness of breath because the airway is closing, the airway is swelling, it's getting swollen. Okay. Runny nose, nasal polyps, these can happen. Nasal polyps is a piece of mass which grows into your nostril. Okay. You usually are not able to see it from outside. If you lift your chin up and use a flashlight, you can see usually on the right nostril. People who suffer from asthma and bronchitis a lot, if you check your nose, usually your right nostril, you will see a piece of mass out there poking out. Okay, so that is polyps. Then you have neurologic symptoms like migraine, neuralgia, that is pain in the nervous system, tension, fatigue, irritability, muscle joint pain, okay, not taking enough rest, stomach pain. These things can happen because of the central nervous system. Systemic symptoms, anaphylaxis. Anaphylaxis, remember, it is hypersensitivity reaction, and it is a very critical condition. You usually require emergency. Okay, you will require some anti-allergen shot on you always, so that whenever you go into a stage of allergy, if you can't access a medical care, at least you can take the epinephrine shot. Okay. Pallor, that is lack of function, headache, cardiac arrhythmias, hypotension, heart diseases are also commonly associated with food sensitivity. So diagnosis, there are different diagnoses. Diet history, most easy one, keep a track of whatever you're eating on a daily basis, morning, afternoon, evening and all. Nowadays, you have apps also for that, which will automatically calculate the calories based on your portion size. Okay. So always use such apps to keep a track on what all things you ate and how did your body react the next day or the same day. Okay. So keeping a diet history is very important, very relevant. Then you have provocative test. So in this test, the name itself, it will suggest provocative test. Small quantity of food that you suspect is causing allergy, you will give it to the client. Okay. And it is not given directly, it is given in a disguised form. Sometimes people who suffer from certain mental health disorders, if they are allergic to mango, okay, they are saying they're allergic to mango. If they eat mango, these things will happen to them. Okay, and you give them mango in front of them. Okay, it will be like they, even though they don't have a reaction, they are pretty much good at acting out the reaction. Okay, so that's why in a disguised form, always give the food in a disguised form. Whatever you think is causing these issues in the patient, give that food in a very in a hidden manner. Okay, so the person will not be able to judge it and act out the symptoms. Okay, because if a person is truly allergic to something, their body will respond to that allergy. Okay, so that is provocative test, just to confirm that exactly what is the cause of their disease. And it has to be done at least 3 times before you are getting the final result. And patients who have severe kind of allergic reactions, like people who take high dose of anti-allergic medications, so they have to avoid these tests. Okay. Then elimination diet, again, the name suggests what would be the meaning here. One by one day after the other, one type of food you will eliminate from the patient's diet. Okay, like this is the patient who eats gluten, he eats lactose intolerant, like he or she is able to manage the milk products. Okay, sometimes in ghee or ice cream or something like that. Okay, so one by one you will set apart a week for these clients and you will go for elimination diet. You will ask them not to eat this particular food this day. Okay, like that. So just to find out what is the, again, to find out what is the exact cause of allergies here. So that is elimination diet. One day, each day, one type of food will be removed from your regular diet and see how your body responds. Then we have lab testing. In laboratory testing, you have skin, radio allergoband, okay, X-ray. In skin test, you must have anyone heard about this 40 injections, allergic injections to find out what is your hidden allergies? Around 40 or more than 40 injections are put. ID injections, intradermal injections are used to get a list of things that you may be allergic to. So that kind of tests come under laboratory test. Okay. Skin test, laboratory skin test, in which areas are marked on the skin. Usually your arm, inside of your forearm is chosen. Okay. Areas are marked and allergen is also placed in a very small quantity, like in an ID case. Okay. And the patient is asked not to wash the area. Okay. For like when the area in which marking has been done, okay, for a few hours or for a day, and then when they come back, they will note down which all areas there had been an allergic reaction. Okay, anyone who had some who suffers from allergy or a specific kind of allergy, wherever that specific trigger was placed, that area may become swollen, broken, wound, or something like that. So that is a laboratory testing on skin. Then you have radio allergosorbent test, radiography. Here again, a barium kind of liquid is used to give it to the patient. Okay, and then through with X-ray they will visualize where and all like any uh, obstructions are there or not in the body. Okay, and a scoring is also given for the radio allergy sorbent test. It is also a skin prick test in which we just want to see that the common allergens like milk, eggs, fish, okay, are these common allergens a part of the patient's history? And if the patient usually scores above 2 means the patient is allergic. And these tests don't give an in-depth knowledge and they give incomplete information, not complete information. Then again in X-ray also, when a food is given, if the person is sensitive to the food or allergic to the food, your intestine will move in a, yeah, it is an expensive test. Okay, yeah, it's better to go for other tests given here. It is much easier to rule out what causes the allergies. Okay, and the radio allergy sorbent test has limitations like only specific kind of most commonly known food like milk, eggs, okay, fish and all. Those can you can rule out, not more than that. So in X-ray test, you want to see how your intestine moves, contracts, relaxes after you have had a specific kind of food. Okay. So these motions will be studied. Okay. And based on that, it will be diagnosed that if the patient has IBS or not. Okay. Usually in IBS, when you have anything that triggers your stomach, or causes you an upset stomach. It's why? Because your intestine is moving in a weird way. Intestine is contracting in a weird way. To catch the way how the intestine contracts after a specific food was given, for that, the third form of X-ray test is done. Then you have the basophil histamine release assays. Basophil and histamines are released whenever you have allergy. Okay, just now, yesterday, if you had some allergic reaction, even if you have taken medicine for it, today you are okay, but still, if you give your blood today for testing, it will show high levels of basophil and eosinophil. Sorry, basophil and histamine. Okay. So that's about diagnosis. Is it clear to all? In children, again, it is difficult to find out food sensitivities. Okay, usually children grow out of food sensitivity, whatever they had during the childhood. Majority of the kids can grow out of it. Cow's milk is the most common allergen in infants. So treatment, elimination diet. The name itself shows you what could be the treatment here. There are different forms of elimination diet. In elimination diet, you are removing the causative food here. Okay, whatever is causing you allergy, whatever is causing you sensitivity, intolerance, you eliminate it from your diet. That is elimination diet. There are different ways of doing the elimination diet. Simple exclusion diet, in which, like, first of all, you will just ask the patient not to drink milk or milk products for a week. Don't consume any eggs for a week. Don't consume any wheat for a week. Okay, usually that is eliminated, and the patient's progress is seen once they have started eliminating these things from the daily diet. How is the body responding? So that is a simple elimination diet. And again, the next point is the multi-exclusion diet, in which if you're not able to get the answer through simple like exclusion diet, elimination diet, only then you go for the second route, that is multi-exclusion diet. So again, it has initial exclusion diets. Initially, for a few weeks, certain things will be removed. Okay. And still, if the allergy persists, and if the patient is still suffering from allergy, again, gradually more things will be removed from their diet. So that is elimination diet. Next is denaturation of protein. Protein also causes different forms of allergy. It is seen that. Okay. So when you are going for denatured form of protein, okay, protein is already broken down. Okay. So it could be more suitable, like hydrolyzed protein and all. Okay, hydrolyzed whey protein. Okay. Now people who are lactose intolerant, they can still have hydrolyzed whey protein because it is partially digested. Whey protein is already partially digested. It is broken down. It is denatured a little bit. Then if you're having the protein, it will not cause much stress on your body. Okay. Whenever you cook the food, boil the food. Okay. Instead of consuming raw milk, always have boiled hot milk. Instead of consuming raw eggs can cause more allergy. Okay. Instead of consuming raw eggs, have cooked eggs, boiled eggs, scrambled ones, omelette. Okay. Always go for cooked ones. It may not be that problematic. Why? Because these foods are rich sources of protein. And when protein get denatured, cooking also makes the protein denatured. Okay, it is easier for the body to digest. So avoid using raw milk, raw eggs if you are allergic. And another treatment is hypersensitization. Hypersensitization. Repeatedly, the doctors will try to push small amounts of this allergic food into the patient to see that the patient is sensitized enough and now the body does not see this food as an invader. Okay, that is hypersensitization. Small doses of food repeatedly of this allergic food is given either by mouth, orally, the patient is asked to eat something, or by injection, it is given so that their sensitivity should just go away. The body sees this food or this allergen as something not that harmful. So it will stop attacking. Then some medications, antihistamines are prescribed. Okay, corticosteroids, antihistamines, bronchodilator if the airway passage is like undergoing swelling. Okay, and if it is closing up, so in that case, bronchodilator drugs will be used. Then dietary advice, like that nutritionist or the clinician, based on what kind of allergy the patient may have, dietary advices are given. Like for example, if somebody is allergic to eggs, okay, you can ask them to take the egg yolk and egg white separately, just to see what is causing the allergy. Is it the egg white or the egg yolk? And see, avoid a specific food for few months, and then after few months start eating that food and see if your body is reacting in the same way. Okay, that can also be given, that such advices can be given. Children usually can grow out of allergies. And rule out that not every allergic reaction is food allergies. Okay, it could be what perfume you are using, what creams you may be using. Okay, uh, like oat based moisturizers and everything is available. Okay, if you are exposing your newborn baby, okay, like infants, newborn babies and infants, before they start eating food through mouth, you are applying oat based, turmeric based, food based, any cosmetics, creams, moisturizers on small babies before you have started weaning, there are high chances that the child will be allergic to it. Okay, so new mothers, or if you are expecting, okay, in the future, you can keep this in mind, that when the child is born, whatever moisturizers, oils, whatever you use on the child, make sure you use non-food based moisturizers, lotions, oils on the child's body, because the child, when it is going to come in contact with food other than breast milk, it should always be via the child's mouth, not on the skin. Okay, so that kind of advice can be given as well. So avoid oat-based moisturizers and all for young babies. Okay, there are lots of in market. If you see oat milk based lotions, body lotions, moisturizers, milk based body lotions and moisturizers, certain oils that are like sesame oil, mustard seed oil, these things. Okay, so try to avoid it. These food, whatever the child is going to eat in the future after that 6 months of exclusive breastfeeding, whatever the child is going to eat in the future, don't put that on the child's body. Okay, to avoid any risk for allergies. So the difference between food intolerance and food allergy. Am I audible? Am I audible? Is my voice clear? Muciferous means mucus producing. Mucus producing. Muciferous plants, I don't have any idea. Muciferous usually mucus producing. So food intolerance and food allergy symptoms. There could be bloating, diarrhea, nausea, indigestion. Okay. Aggravation of existing asthma, eczema. Eczema is that skin rashes, okay, but it's very itchy condition of the skin. It is eczema. And in food allergies, symptoms could be hives, itching, swelling, vomiting, diarrhea, nausea. So, in food intolerance, it can occur when you're not able to, your body is not able to digest certain food. Okay, or your body does not have specific enzymes or mucus, does not have enough mucus to digest food or to consume certain food, break down food. Okay, yeah, undigested food could lead to these symptoms. It's not life threatening. Just after a diarrhea or if you pass the motion, you will be fine. Okay, food allergies, it can be life threatening if it affects your airway and breathing. Okay, not able to breathe properly. If your brain does not get enough oxygen on time, it can be a potentially life threatening condition. And here your immunity is involved in food allergy. It's always your immunity is usually involved. In intolerance, immunity does not play any part. Okay. What are the similarities between both of them? There is no specific cure for both. Okay. Either it can resolve over time with, if you're dealing with a child, it can resolve over time. Let the child grow out of it. Okay. And if why the body is not able to make certain enzyme, it is genetics. Okay. And why the immunity is working like that, that is also hereditary. Food allergies can be hereditary as well. You can inherit that. And foods that can trigger intolerance can also be like it can be eggs, shellfish, nuts, dairy, wheat, gluten, fish, soy. Okay. Then you have FODMAP. FODMAP is important. This abbreviation and contents can come for exam. So FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These all are carbohydrates, okay? All are carbohydrates, but fermentable. These things have to be avoided for some time. See how your body responds. Okay, see how you are keeping up. Like, is your stomach happy? It's no. Are you suffering from nausea or vomiting? When you avoid these things, when you completely avoid oligosaccharides, disaccharides, monosaccharides, polyols, avoid it from your food and see how your body responds. Okay, examples of all these food oligosaccharides are like your white bread, certain legumes like rajma and all. Okay, rajma also causes insensitivity. You must be aware of it. If it is not cooked properly and all. Okay, some legumes and beans can cause food sensitivities. It comes under oligosaccharides. Disaccharides like cheese, which is present in all milk products. Milk products come under disaccharides. It's a carbohydrate. Okay, cheese, yogurt, milk. Monosaccharides, your fruits. Okay, even syrups like maple syrup, honey. Okay, that also comes under monosaccharides. Polyols is your artificial sweeteners. Okay, it is fermented sugar. Okay, the alcohol, it's a sugar alcohol. Fruits that are too much of ripe, they have uh, ripened up a lot. Those also will produce polyols. Okay? It's actually sugar alcohol. Polyol is a sugar alcohol. Okay, it's very sweet in taste. Polyols. So avoid these things and see how the stomach, your digestion is. Okay, see how the symptoms go away for a while, and later slowly you can introduce and see how your body is reacting. Okay, so shopping list, it kind of looks like this. Okay, a FODMAP shopping list. Like if you are suggested to be on low FODMAP diet, these are the things that you are allowed to. Okay, if you have lot many food intolerances or suspected allergies, okay, you can just take this shopping list and work with these food items. Okay, all the five food groups are here. Like not the protein ones, apart from that. Okay, not the meat and everything. Like wherever you will find carbohydrates, that comes under FODMAP. Okay, so this will be your shopping list. Your entire menu plan, meal plan should come from only these many items. So these items are naturally low in oligosaccharides, disaccharides, monosaccharides, polysaccharides. Sorry, polyols. Okay, so when you cook your food according to these list given, you are on a low FODMAP diet, and chances are that you will not suffer from too much of bloating, nausea, vomiting, or any food insensitivity to intolerance or allergy based symptoms. Okay, you can take a screenshot of it for future reference. So that's all for today's topic. If you have any queries,